Mr. Speaker wants to start by reading the Prime Minister a message that I've received from a man called Keir. Keir wasn't able to go to work today and his children couldn't go to school because his family had to wait for their coronavirus test results despite the Prime Minister promise of results within 24 hours. Yeah. Keir was able to do the right thing and self-isolate and work from home. But other people aren't in this position, Mr. Speaker. What is the average hourly rate of a care worker in this country?
Apparently, Mr. Speaker, he has had a negative test. I don't know quite why he is not here. It is this government that has instituted the national living wage to ensure that every worker in this country, including care home workers, is paid substantially more thanks to the care and the work of the people of this country.
Finished. OK. The whole country, Mr. Speaker, would have seen that the Prime Minister doesn't know how much a care worker earns, because that was my question. The shameful fact is that the average wage in social care is barely more than £8 an hour.
We will make sure, Mr. Speaker, and as we have done over the last few months, that they get the PPE that they need, that they get the guidance that they need, and they get the cash that they need. And that's what this government is committed to doing.
Well, Mr. Speaker, I do welcome the Prime Minister's comments, but I must say to the Prime Minister, get some skates on it. The Prime Minister has put his faith in Operation Moonshot, but meanwhile, on planet Earth, there was no NHS tests available for several high-infection areas, including Tameside and Oldham, in my own constituencies. Do all care homes in this country have weekly tests?
Well, Mr. Speaker, yes, to the best of my knowledge. Per 1,000 people, Mr. Speaker, this country is testing 2.54, Germany 1.88, Spain 1.91, and France 1.89. In other words, we are delivering exactly what we said we would do. What is happening, Mr. Speaker, is that the British people, quite understandably, are responding to that system with a huge surge in demand.
Mr. Speaker, once again, I see that the Prime Minister says it's somebody else's fault. It's the public that are using up the tests. The Health Secretary said yesterday it would take weeks to sort the situation out. Well, Mr. Speaker, we don't have weeks. And the next time a man with COVID symptoms drives from London to Durham, it'll probably be for the nearest COVID test. And what was the top priority for the COVID War Cabinet this weekend? Restoring grouse shooting. I suppose, Mr. Speaker, it's good news for people like the Prime Minister's friend who paid for a luxury Christmas getaway to a Caribbean island and funded his leadership campaign and just so happens to own 2 Grousemoor estates. So, Prime Minister, is this really your top priority?
While the Labour opposition has been consistently carping from the sidelines throughout this crisis and raising, frankly, I think issues that are tangential, if not scare stories about what is going on. I don't think anybody is in any doubt that this government is facing some of the most difficult dilemmas that any modern government has had to face. But every day we are helping to solve them thanks to the massive common sense of the British people who are getting on with delivering our programme, getting on with delivering our fight against coronavirus. And it's with the common sense of the British people that we will succeed, build back better and stronger than ever before.